This online panel survey powered by Vox Opinion Research is the research arm of Publicus in partnership with Lightspeed, the Asia Pacific Regional Headquarters of Kantar. Kantar is the leading firm in the global data industry with the reach of 88 million respondents in 90 markets worldwide. I'd like to acknowledge at this point our friends from the media, some government institutions, the academe, and the business sector in this presentation. Some friends were asking us, is Publicus spinning off into a research firm? Friends, we are not. But research is our staple for the past 17 years. We are just now sharing to a wider audience the findings of our non-commissioned researches as one of our corporate social responsibilities, especially in a national crisis such as this COVID-19 pandemic. What we are sharing with the various stakeholders and the general public today, with the help of media, are analysis of data gathered and insights gathered in the second run of online panel survey. The first virtual presser we did to share the results of the first run was last April 8. Our Executive Director, Aurelie Sinswat, will tell you more about the results of the second run, including the methodology employed. Results of the first and second runs will be posted on Publicus' website, so readily you can backtrack on them. We also try to be as interactive as we possibly can. So you can text your queries to us as Aurelie presents the findings, and Benny will moderate the Q&A portion. Should you have more queries, Aurelie and our Chief Data Scientist, David Yap, PhD, would gladly respond to them via vox@publicusltd.com. So let's go on with it, Benny.
Thank you, Ms. Amato. Today's virtual pressure will cover the details of the second run of the panel survey in relation to the COVID-19 pandemic. Before we begin, I would like to encourage everyone to send in their questions during the briefing. For our Facebook audience, key in your questions in the live feeds comment section, and for our Zoom audience, you can send in your questions during the Q&A feature of Zoom. Without further ado, I now turn over the screen to Mr. Aurelie Simsuwal to share the findings of the panel survey. Mr. Simsuwal.
Thank you, Benny, and thank you, Ma'am Lilibet, for that nice introduction. So thank you again, everyone, for joining us for the virtual presser of our second run of the NCR COVID-19 online panel survey. Again, this is a independent, non-commissioned survey. Specifically, our sample for the second run, just like the first run, consists of an online panel of 1,000 Filipino respondents aged 18 to 70 years old and residing in Metro Manila. The panel was provided by Lightspeed, as Ma'am Lilibet discussed, from its pool of 100,000 Philippine panelists. The field work for this survey was conducted online from April 13 to April 18. If you'd like more information on the survey's purposive sampling method and panel selection process, we actually have a much longer paper on this on our website, and the link can also be found in the executive summary. Now, respondents were asked to answer a short structured questionnaire online. The questions and answer options were provided in English with corresponding Filipino translations. The survey questions were designed to gauge the opinions and perceptions of the respondents on the following four key variables. First, living standards and needs under the ECQ. Second, national government performance. Third, local government performance. And fourth, existing and proposed COVID-19 policies. Responses from the completed questionnaires were recorded in the system and transmitted in real time to Publicus and Vox. The full dataset was processed and analyzed by Vox. So now let's jump right into the results, starting with a short discussion on the panel demographics for this particular survey. So regarding age, almost 80% of our respondents for the second run survey are members of Generation Y or millennials and Generation Z. 46%, the plurality of respondents were between the ages of 18 to 29 years old, and another 33.4% were between the ages of 30 and 39. 12.5% of the panelists are aged 40 to 59, while 6.9% of them are between the ages of 50 and 59. The remaining 1.2% are between 60 to 69 years old. Regarding the city and municipality of residence, it's the exact same sample as what we used before in the first survey. The number of respondents per city is proportionate to official population statistics. Quezon City, Manila, and Caloocan have relatively larger sample sizes as they comprise a significant percentage of the total population of NCR. Meanwhile, Pateros, San Juan, and Navotas have relatively small samples, as Pateros is a municipality and San Juan and Navotas are relatively small cities. Regarding household size, most respondents live in a typical 3 to 5 member household, more than half. Almost 1/3 live in large households with 6 or more members, and less than 10% live alone or with just one other person. Moving on to household income, more than 1/3 or 34.3% of our respondents live in poor or low income households earning 19,040 pesos per month or less. 25.8% live in lower middle income households earning between 19,000 and 38,000 per month. 20% live in middle class households earning between 38,081 and 66,640 per month. And the remaining 15.7% live in upper middle income, upper income, and rich households. So if we go to the next slide, I actually put into the presentation a comparison of the panel demographics of the second round of the NCR COVID-19 survey with the estimated distribution of the population per income bracket in NCR from the 2015 Family Income and Expenditure Survey by the Philippine Statistics Authority. You can see here that while there are some differences, such as, for example, the lower middle class are a little underrepresented in our panel, in general, our panel also has a good mix of socio-economic backgrounds among its respondents. And I'd also like to note that the poor, the lowest income bracket, are actually overrepresented by by 100% in our survey. And I think that's good, and that's good because we can gauge their opinion more. Moving on to gender, there's again, like the first survey, there's a significantly higher proportion of females, 64.6% compared to 35.4% male. Moving on to the first section of the actual results, living standards during the ECQ. For family condition, we can see here that a plurality of the respondents, the largest group, 41.8%, indicated that the status of their family is neither good nor bad during the ECQ. 39.5% said the status of their family is good or very good. Only 18.7% of respondents said the status of their family under the ECQ is bad or very bad. Now, when we compare this to the first run results, we can see that they provide some indication that the overall condition of families may be deteriorating over time under the ECQ. If we compare these second run results to the first run, we'll notice that good or very good family condition has decreased by 8%, while bad or very bad family condition has increased by 3.7%. And then here, when we look at this slide on previous slide, please. When we look at this slide, when we break down family condition during the ECQ by income, we can see the respondents from the three lowest income groups recorded higher incidences of bad or very bad family conditions compared to the 18.7% average across all income groups. Roughly one-third of respondents from poor households reported bad or very bad conditions for their families. 22.67% of respondents from low-income households and 21.7% from lower middle income households also indicated bad or very bad family conditions. Moving on to the next slide, supply of household necessities. More than half of respondents, 52.6%, said their households have enough food or water to last them for 1 week or less. 29.5% said they have enough food and water for a week or two. And the remaining 17.9% said their food and water supplies would last them for more than 2 weeks. These results actually indicate a marked improvement compared to the April 2 to 6 run of the survey, when 58.6% of respondents said their food and water supply was only good for 1 week or less. So essentially, this means that this panel, compared to last week's panel, has a longer supply of food and water in stock at their households. And then looking at this slide, when we break it down by income, the data show a strong correlation between monthly household income and sufficiency of food and water supply. Almost 2/3, 65% of respondents from poor households said their supply would last 1 week or less. The proportion of respondents indicating a household supply of food and water good for 1 week or less decreases, as we can see here on the graph, as the monthly household income bracket goes up. And then all the way to the rich demographic, those households making 190K or more per month, where only 33% of respondents said their food and water is only good for a week or less. Now moving on to money. 50% of respondents said their households have enough money for 1 week or less. 28.1% said they have enough money for a week or two. And the remaining 21.4% said they have enough money for more than 2 weeks. Next, for medicine. 56% of respondents said their household supply of medicine was only good enough for 1 week or less. 27.4% said their supply was good for 1 to 2 weeks, while 16.6% said their supply would last for more than 2 weeks. Going on to the next slide, this is a new question that we asked in the second run of the survey. It involves the loss of employment under ECQ. Essentially, we just asked respondents if any member of their household had lost employment due to the ECQ. According to the data, 64% of respondents reported that at least one member of their respective households who was employed before the ECQ has lost his or her job due to the ECQ. The data suggests a strong negative correlation between income and the likelihood or incidence of job loss. More than 78% of respondents from poor households reported that at least one member of their household had lost their job due to the ECQ. The proportion of respondents who reported job loss in their household decreases as household income increases, just like we saw with the food and water earlier, with only 1/3 or 33% of respondents from rich households indicating that someone in their household is now unemployed due to the ECQ. So we move on to the second variable, which is national government perceptions. What we'll look at first is confidence in national government's ability to contain COVID-19. For this run, 43.5% of respondents think there's only a 50-50 chance that the national government will be able to contain and prevent the spread of COVID-19 in the country. After that, 33.4% responded that they thought there is a high or very high chance that the national government will succeed in containing the pandemic. 23.1% had low or very low confidence in the government's ability. Again, when we compare this to the results from the first run survey, uh, the results indicate a moderate decrease in confidence in the national government's ability to contain COVID-19. We note in the previous slide that the proportion of high or very high responses decreased by 6.6% compared to the first run, while those with low or very low confidence in the government's ability increased by 4.4%. However, despite the modest decrease in the confidence in the government's ability to fight COVID-19, we can see here on this slide that still a sizable majority, 69.7% of respondents, approve of the manner in which President Rodrigo Duterte and the national government are responding to the COVID-19 pandemic. An additional 15.3% either disapprove or strongly approve, while 15% neither approve nor disapprove. These results indicate a 3-point increase in approval of the Duterte and national government COVID-19 response compared to the first run of the survey. When we move on to the next slide, which breaks down the PRRD and national government approval by income bracket, I would just like to note here that approval is higher than average among respondents from households classified as low income, who approved of the president and the national government by almost 74%, and also lower middle income. They approved almost 70%. Meanwhile, disapproval was higher than the 15.3% average among several of the among respondents from households classified in several of the classifications. The highest disapproval came from upper income, which was 26.32%, then upper middle income, 22.43%. The rich demographic disapproved 16.67%, then middle income 16.5%, and lower middle income 16.28%. Moving on to the Interagency Task Force on Emerging Infectious Diseases, more commonly known as the IATF-EID, a majority, 59.7% approve of the IATF-EID's response to COVID-19. 26.6% neither approve nor disapprove. 13.7% approve or strongly disapprove. Now, the Department of Health retained its a slim majority approval in the second run of the survey. 51.3% approve of the DOH response to COVID-19. 27.6% neither approve nor disapprove, while 21.1% disapprove. These results indicate a slight 1.7% decrease in approval from the April 2 to 6 run. Now, when we talk about the Department of Social Welfare and Development and its social amelioration program, sentiments of respondents on how DSWD is implementing the SAP program are divided. The largest proportion of respondents disapprove at 36.7%. So 36.7% disapprove of how DSWD has been implementing the social amelioration program. Meanwhile, another third, 33.2% approve, while 30.1% neither approve nor disapprove. This is a new series of questions in our second run. We asked respondents what their preferred form of assistance from the national government would be. And among money, food and water, medicine, and free testing kits, money received the highest amount of approval at 94.7%. Although we have to note that even the lowest, which was free testing kits, also received 91.3%. So let's move on to local government perceptions. So local government perceptions, this was probably our most talked about segment in the previous survey. Um, this is, we see here the general picture. So this is how this slide shows how how our respondents feel about their mayors and local government units as a whole. So the largest proportion, just like last time, 43.7% approve of the responses of their respective mayors and city governments to the COVID-19 pandemic. Meanwhile, almost one third, 33.2% disapprove of the performance of their mayor and city government, and 23.1% neither approve nor disapprove. So the data indicate a negligible 0.5% increase in approval and a slight 1.3% decrease in disapproval compared to the first run of the survey. Now, the next slide shows the approval of mayor and LGU COVID-19 response by LGU. And let's go to the chart on the next slide, Benny. So this is the chart of the data. You can see here that the green is strongly approve and approve. The gray is neither. Disapprove is red, or strongly disapprove is dark red. We would like to note here that the when you sort the data by LGU, mayor and LGU approval was highest among respondents residing in Pasig, number one, with 84.74%. Number two was Valenzuela with 81.25%. Number three was ranked third was Marikina at 80%, and ranked fourth was Manila at 73.19%. So next we move on to the assistance already received. These are some heat maps, as we can see, of approval and disapproval. You can take a look at those when you download our deck online. Anyway, let's go to assistance already received. So we see here that 84% of respondents to our survey have already received food or relief packs from their respective LGUs. And then moving to the next slide, when it comes to financial aid or money, 20.8% have also received financial assistance from their respective LGUs. Moving on to the next slide, we asked the same question of what form of aid people would like to receive from their LGUs, and food and water was the most preferred for LGUs at 94.3%. Although again, like with the national government, money, medicine, and free testing kits also had high percentages. The lowest one was free testing kits, but still 89.9% of respondents said they also would like to receive free testing kits from their local government units. So we move on to the final variable, or perceptions on COVID-19 policies. So first, regarding the enhanced community quarantine, an overwhelming 84.2% of respondents approve of the Luzon-wide extended community quarantine, an increase of 2.2% from the April to the 6th survey. 9.7% neither approve nor disapprove, and only 6.1% disapprove. Moving on, this is an important question that we added for the first time in our second round of the survey. As we've seen if we've been reading the news, there have been a lot of talk about when the ECQ should end. Executive officials and lawmakers and private entities have all been giving different proposals as to when the ECQ should end. So we asked respondents a simple question: when do you think the ECQ should end? Now, looking at the data provided on the screen, we can see that an overwhelming majority, or 77.8% of respondents, want the ECQ to end within the next 2 to 6 weeks. So at latest, May 31st. Between the four options that we provided, the largest proportion, or 32%, want the ECQ to end sometime between May 1st and May 30th. So this means that they are willing to have a short extension from the April 30th expiration date of the extended ECQ. Followed closely was the 31.2% who want the ECQ to end already on April 30th, which is the date when it is set to expire. 14.6% want the ECQ to end on May 31st, while the remaining 22.2% wanted to end sometime after May 31st. So this means that would be a much longer extension. Another new question, as we know, the government has been expanding its COVID-19 testing program. So in this round of the survey, we asked, which of the following options would you prefer? Mass testing, including those without COVID symptoms, or targeted testing only for symptomatic patients? The sizable majority, 68.3%, want the government to conduct mass testing. So this includes people without COVID-19 symptoms. Meanwhile, 30.5% support targeted testing for people with COVID-19 symptoms only, and 1.2% do not want the government to conduct wider testing at all. Now, moving on to the summary of the other COVID-19 policies that we tested. You see here a summary of them. You'll recognize 7 of them. We took them up in the last survey. And again, providing frontline medical services people with additional pay was the most supported policy tested here. We also note that the least popular policy was, again, providing big businesses with financial support. This is the only policy that did not get a majority approval, only 43.5% approved. However, I would just like to highlight the results of the 3 new policies that we added in this survey run. The first is we asked respondents if they agree with increasing the number of families qualified to receive financial assistance under the Social Amelioration Program, and an overwhelming 94.4% of respondents said they agreed. We also asked whether or not respondents agree with the immediate rollout of the national ID system to facilitate faster delivery of financial assistance and other aid to families affected by crises such as COVID-19. This also garnered 86.8% approval. And the third new question is, or the third new policy we tested is whether or not they approve of providing financial assistance to middle-class families under quarantine. This also garnered strong majority approval with 83.8%. So with that, I'm finished with the presentation proper. Thank you for listening. I'll turn it back over to you, Benny.
Thank you very much for your explanation, Mr. Sinsuwat. At this juncture, we would like to receive the questions from our audience on Facebook and Zoom. Let's stand by for the questions.
Okay.
Let's see. Okay, let's read one question here.
So again, this is the second run of our survey, just to remind everyone, and we will be holding a third run of the survey as well, sometime in late April. So you can look out for those results again. And just reminding everyone, if you haven't had a chance to take a look at it, you can find the executive summary and the full media deck of our survey at publicusasia.com. So you can check it out, and download.
A question reads, the survey showed data on forms of assistance already received from the local government. How can this be utilized as a base point for more proactive measures?
We see in the data that 84% of respondents have already received aid from their LGUs in the form of food and relief packs. And that is a high number, especially when you take into account that not all families would require food packs. Like, for example, the rich or the upper income income bracket. But also, when we look at the types of assistance that people want to receive, this can be used to prioritize how government resources will be allocated, both by the national government and by the LGUs. And we see a clear distinction between what respondents are expecting from local government units compared to national government units. The local government unit as really the closest branch of government or arm of government to respondents. Uh, the respondents want their most basic necessity, which is really food and water. So, and I think the LGUs know this, and they have been implementing this. Whereas from the national government, it's really more financial assistance, and this is also in recognition that the national government has more significantly more financial resources to fund something like the social amelioration program compared to local government units. So I think the local governments and the national government need to synergize their relief efforts. They don't need to give the same thing. They don't both need to give food and money. They don't both need to give money, but they should synergize what they are doing so that they can complement each other and provide the various different needs that respondents or that Metro Manila residents and Luzon residents need under the ECQ.
All right. Next question. The idea of mass testing has now been adopted by the DOH. Did this influence their current level of approval and disapproval? What do you think would change if the DOH continues to reject the idea of mass testing?
Well, the if we look at the new case classification system of DOH, it's actually targeted toward it's to implement targeted testing, not mass testing. When we move to the suspect, probable, confirmed cases classification system, essentially it prioritizes the testing of symptomatic patients. And considering our existing laboratory capacities, this is a realistic option for the DOH to take. This does not mean, however, that the DOH should stop in its push to accredit more COVID testing labs. We can acknowledge certainly that the testing capacity of the Philippines as a whole has increased significantly in the past couple weeks as the Department of Health has prioritized accrediting new labs. I saw on the Department of Health website as of yesterday, we now have 17 labs, and significantly, 12 of these are in Metro Manila, which is the epicenter of the COVID outbreak here. Eventually, we will have to do some sort of mass testing for asymptomatic people. It's a way for us to really flatten the curve, and more importantly, mass testing is a critical component of a science-based decision tool which will allow us to identify low risk areas that can uh, where the quarantine and other restrictive lockdown measures can be lifted. So I think the data show here actually that the approval of the Department of Health would certainly be affected by how they respond to what is a clear clamor in the survey for mass testing, at least in Metro Manila.
Question reads, most of the respondents said that at least one member of their household has lost employment due to the ECQ. However, the data also showed that majority of the respondents also want the ECQ be extended. So could there be a workaround, or this how is there a workaround for this? How do you?
Well, if you're asking me to interpret what that means. That the data indicate that the the health and safety aspect of the enhanced community quarantine are more important to respondents than the loss of employment. If we look at the data, we remember that the incidence of job loss was higher, the lower base for the lower income groups. And this is easily explainable. These lower income groups are often employed in sectors or in specific jobs that simply cannot be adapted to work from home arrangements. Like, for example, retail, or maybe they're in the informal sector, um, PUV drivers, taxi drivers. Uh, these are uh, these are jobs that just simply cannot be done from home. They require someone to be physically present. Construction as well. Uh, so to keep these families afloat, or if the ECQ is extended, it will really be up to the national government, local government units to take action. When it comes to the national government, they'll really have to ensure the efficient, speedy, and transparent implementation of the social amelioration program. As we see here in our survey, the respondents were not exactly pleased how the DSWD has been implementing the program so far. And this outcry has also been heard from some LGU officials. So the national government will need to improve this as well. Whereas local government units need to continue ensuring that their constituents have food, water, and other basic necessities to tide them over while the ECQ continues and while we try to flatten the curve.
Okay, Mr. Sinsuat. Next question. The approval of the response of the president has increased. Do you think that this will be sustained in the next run of the survey? What are the things that the president is doing to get such increase in approval?
Well, we can't say for certain whether or not the president and the national government's approval rating will stay high or continue to climb in the next survey. A lot can change in a week or two. This is precisely what we do runs of the where we conduct the survey once every 7 to 10 days, specifically because a lot can change in a matter of days when it comes to public perception and COVID-19. One thing I'd like to note from the data is that there is some indication that perhaps the approval of the president and the national government is somewhat tied to the approval of the enhanced community quarantine as well. We noticed that both in the first run and the second run of the survey, approval for both the president and the national government response, as well as approval for the ECQ, are high. And we saw that a small 3 point increase in the president's approval corresponded with a 2 point increase in approval of the ECQ. This is understandable because the ECQ has been the most well-known, most publicized measure of the government to fight COVID-19. And we can see from statistics that we have begun flattening the curve and that it has been effective, certainly, in fighting the COVID-19 pandemic. But the ECQ will have to end eventually. And the longer that the ECQ goes on, the more our economy suffers as well. So when the ECQ is finally lifted, or perhaps partially lifted in some areas, it depends on what the government does, we will the approval of the president and the national government will be more tied towards how they help us cope with COVID-19 and the aftermath. So this would include more widespread testing, perhaps studying the possibility of really starting mass testing for asymptomatic individuals. It'll be also on how the stimulus package that the government will pass. This is not the SAP, but more on the stimulus for small businesses and other economic policies. So that is how the president and the national government, how their job performance will be measured moving forward.
This question is, since it's related to the national ID system, do you think that the rollout of the national ID system is possible given the numerous tasks posted to various agencies and LGUs today? What are the alternatives to the national ID system?
Well, we remember that the PhilSys law was signed into law by President Duterte on August 8th, 2018. It is now April 2020, and the the national ID, has still not materialized. So this is certainly this is a shortcoming of the government and of the Philippine Statistics Authority in particular, which is the lead implementing agency of the PhilSys Act. That being said, it would be difficult to roll out something as complicated and something that requires so much manpower as the national ID system immediately at this time. The problem with this is that there are one alternative that we could do. The national ID system essentially provides it's like a one-stop shop for all of the data of the citizens, which is why it's very powerful in financial aid or aid operations, because it's easy for the government to identify who is eligible for what type of aid. Perhaps something that the government could do in the short run is to really synchronize and all of the databases of the line agencies uh, and have a lot more information sharing among the agencies. Like, for example, DSWD, DILG, and all the other agencies with wide databases of citizens should really pool their database resources together and work as one to really identify those people who are in need of aid.
Thank you, Mr. Sensuat. Next question is, the data showed the level of approval and disapproval for the IATF. With the IATF being an interagency task force, do you think that the public sees it as a different entity altogether, or is the perception of the IATF heavily dependent on the individual achievements and or failures of the agencies that belong to it?
Um, the IATF, you can see here when we compare it to the approval of the president and the national government, it's different. It's a little lower. So these data indicate that the IATF EID is really seen as a different body, a different institution within the national government. It is, and that is how it's been communicating itself also in since the start of this crisis. The IATF EID is like it's the it's like our Center for Disease Control. We don't if you're familiar with the American Center for Disease Control, they're the ones who are uh, really on the front lines of the pandemic. It's kind of like that for us a little bit. It's our task force specifically against COVID-19. Uh, the IATF EID is really more on the actual public health side of COVID-19. So they are the ones, fighting the disease itself, whereas other agencies like DSWD are the ones who are providing the auxiliary services, such as providing the social aid. So IATF EID, based on the data, definitely is a seen as a separate entity by the public.
Thank you, Mr. Sensua. Next question. How will the inclusion of middle class families change the way things have been running in relation to the distribution of the SAP? Will this affect the poor sector, which was the initial focus of the program?
The government has allocated billions of pesos for these programs. And based on what we've been hearing for the national government, the assistance for middle class families is separate altogether from the social amelioration program. As long as we have the funds available, and this will be a tricky financial situation for the DOF, admittedly, considering that the tax collection deadlines have been put off. But it's not really a funding issue, it's more of an identification issue. And when we what I can say is that middle class families would be much easier to identify than, say, the poor or lower income families under the social amelioration program. Middle class families have government IDs, they have houses and phone numbers where to be contacted. They have these official documents that makes it easy to for them to register in the system to receive the financial assistance. Whereas, as we know, many of the poor and the near poor might not have, these records such as the government IDs or proof of residence, things like that. However, we should not see the providing assistance to middle class families as taking away from the poor or the near poor, because the government, it sounds as if the government will be making sure that the poor and the near poor are well provided for. It's just it's not taking uh, it's not taking a larger piece of the pie, but it's making the pie bigger, which is precisely what's needed. Because as we saw in our data,
families are also affected by the ECQ. Middle class families are also losing jobs, or members of middle class households are also losing their jobs. So it's only necessary for us to provide them with financial assistance as well.
Next question. The high or very high confidence level in the national government, but the national government's ability to COVID-19 decreased, while those that reported low or very low confidence level has increased. What factors might have contributed to the sudden decrease in confidence and an increase in dissatisfaction?
It's a good observation. At first glance, it would seem contradictory for the confidence in the national government's ability to fall while its approval would rise. I would like to point out that how that question specifically is worded is it is uh, the respondents are asked what is the likelihood that the national government will be able to contain or prevent the spread of COVID-19. I would I would say that the lowered confidence is a product of the increasing number of cases in the country. So respondents would see it as a matter of fact that uh, in terms of containing the spread, um, the government has not been able to prevent the spread as much as it could have because the number of cases have been rising. Although we have to uh, note also that the doubling time of cases has decreased significantly since the start of the ECQ. Now, again, the our my theory, what the data, my theory based on the data is that the approval of the president and the national government is closely linked to overall approval of the enhanced community quarantine. When the approval of the president and the national government rises, so does approval of the ECQ. And this is because the ECQ is the most visible and the most widely felt uh, anti-COVID-19 measure of the national government.
In the case of the ECQ, in case the ECQ will be extended until the end of May, would you have projections on how much is needed for the SAPs, for the poor families, and the middle class? Is the president's budget enough?
Well, I do not have the figures on how much it would cost to include middle class families in an expanded social amelioration program until the end of May. That is a good question, and we should ask the government for that. However, I can say that the president would have immediate funds available. If we remember under the Bayanihan to Heal as One Act, which was passed by Congress in its special session to deal specifically with COVID 19, there are many provisions there allowing the president to move around, transfer parts of the budget, create savings, and essentially utilize the entire, in theory, utilize most of, if not the entire 4 trillion peso 2020 budget for fighting COVID 19. So, certainly the funds are there. It's just a matter of identifying who needs these funds and identifying and counting exactly how much we will have to spend on these aid measures for our countrymen.
Thank you, Mr. Sensuat. The previous survey only showed money, food. Um, how did the inclusion of free testing kits change the results? And what does this imply to have include the testing kits as a question in the panel survey?
Well, we included testing kits in the survey because we also included the question on mass testing versus targeted testing. And we also realized that some local government units have actually begun their own testing programs. So this is a form of aid that the local governments have been giving. So we included it in our survey as well. In terms of how it changed the survey, it didn't change it much. Uh, in both cases, in the local government and national government, test free testing kits were still the, well, comparatively least popular um, form of aid. Although they still got 89% of respondents said they wanted testing kits. But in terms of how it changed the survey, I don't think it changed it much. It did not change the survey much.
From Rose Fuentes on Viber, there are complaints regarding the distribution and receipt of government aid. How is government handling the issue, especially because there is seeming reliability on the claim and issues regarding that?
Well, I'm not a government spokesperson, so I can't speak for how the government is handling handling this issue. I would just like to reiterate what I said earlier, that ideally we would have the national ID system in place now, but since we don't, the various government frontline government agencies which have extensive databases of citizens really need to share information with each other and bring it and um, so that they can work together to identify in a transparent manner these people, the recipients or the beneficiaries of this aid. In terms of transparency, that will increase the transparency because they can cross-validate theirs with one another and maybe take out any ghost beneficiaries that might exist, or essentially they will just be double validating each other's work. And through this interagency synergy, we can improve the transparency and accountability in how these funds will be handed out by the government.
Well said, Mr. Sinsurat. I hope that your answers have clarified some um, issues on our survey. So it's time for the survey, the questions for today. To be updated with our reports and releases such as this, do follow us on Facebook and Instagram. and Twitter. Visit at www. Thank you
Thank you.
very much, Mr. Thank you very much.